Hi everyone, welcome to NATCO Studio Room. Today I am being with an eminent personality and a great doctor, Dr. Visheshwara Rao from Labdo West Health Center. Sir, welcome to NATCO Studio Room, and we are so honored that you are to be with us. Well, I have some few questions to ask, and we are grateful to know about your wisdom about these things. It will definitely help our younger generation.
Sure, thank you.
All right. So how does ceftazidime avibactam perform in treating hospital-acquired pneumonia caused by CRE?
Hospital-acquired pneumonias has not been a major component of my medical practice in the recent past, which I was trained as a neurointensivist about 20 years back, where it's something we used to see more common. And when I moved from neuroanesthesia to transplant anesthesia, that was another area we were faced with. In the fag end of my career, where I'm coming to a basic community care, it's not been major issues that I'm addressing. So it is an issue. It is an issue facing all the issues that I have seen, and the prolonged stay and of post-surgical patients or post-traumatic patients. It has been an issue. Probably it continues as an issue to worry about. I do not have much experience in this area at this stage.
All right, all right.
Because I happen to be I have worked in British Isles, Australia, where predominantly the anesthesiologists run critical care was a norm in the past, which has changed in the last 20 years. Now, critical care has been taken over by other specialties like internal medicine, surgery, and also now coming the emergency medicine, and people are taking it over. So it's a multidisciplinary team that is participating and everybody contributing a little into critical care, whereas the time I was trained, it was basically because critical care involved in cardiac support and pulmonary support, and we being in anesthesiology, we are primarily focused in dealing with these two areas. It has started off. In North American system where I'm presently practicing, it is our specialty is no more really involved in the day-to-day management of critical care unless we are in a peripheral setup where we are jack of all trades. You know, that's the sort of situation I am in. So if you're asking me anything that is advanced in nature, probably I will have limitations in answering what you say.
So let me ask you, have been working with British?
Yes, I've been trained in British Isles.
Oh, that's why you do have the
I worked in Caribbean for a fairly long time, then I moved on to British Isles, where I enhanced my further training, then I moved on to Australia, now I'm in North America.
Ah, yeah, that's why you have the British accent, right?
Well, you can put it that way if you like. So basically, I'm a practicing anesthesiologist now, coming to the fag end of my career, I would imagine. Having practiced for almost 45 years now, so it's more of the end of my career, coming to an end of my career, yes.
For a doctor, career never ends.
Beg your pardon?
For a doctor, career never ends. He has to live.
Well, yeah, the thing is that unfortunately, I belong to a generation where there is no focus on other things to do in life apart from focusing on your education if you want to be successful in life. So now that we end up with no hobbies to pursue, this is the only way to maintain our sanity and our social life and sanity.
You can start right now.
Beg your pardon?
You can start the hobbies.
Oh yeah, they say that there's not. Right? The thing is, it's very. If you start, you're never too late for anything. But having said that, I never dare to venture something new. Right? So people say, why don't you live in a place where it's always filled up with snow? Why don't you go for skating and skiing? I said, I'm more worried about fragile bones. So it's a little difficult time to take up others. But anyway, it's never too late. And I enjoy what I'm doing, that maintains the sanity. I'm probably less nuisance to my wife in kitchen, so that keeps going there.
So ladies and gentlemen, we are going to conclude NATCO Studio Room with our great personality and the great doctor, Dr. Visheshwara Rao. Thank you so much, sir, for coming here, and really privileged to be here with you. Thank you again and again.
Thank you very much, and it was great that you were able to give me a little time and try to vent my ideas.
Well, thank you so much for accepting our invitation.